Typically, baby blues is time limited, so you really only see that the first couple weeks after a baby is born. By 2 weeks in, if you're still feeling cheerful, down, depressed, things like that, then we're really starting to get into that postpartum depression category, which can start from days after delivery all the way to a year out. So it is something that timing makes a difference. And of course, if you are feeling so sad and tired that you're just not getting out of bed those first couple weeks, then that's probably more than I would expect from the blues. At that point, I'm probably already concerned that we're moving into depression. Really, any history of anxiety or depression, especially if it was ongoing during the pregnancy, is going to be the biggest risk factor for having depression postpartum. But there are a few other things, very traumatic deliveries, acute stress after. There are any kind of stressor really is a trigger for depression, not just outside of pregnancy, but also in pregnancy and postpartum period when women are just a little more vulnerable. We all hear the stories about women being more emotional to start with. I don't necessarily believe that's true. So if someone is acting out of their normal, that's definitely something to pay attention to. Yes, every new mom is tired, especially if they're getting up and doing all the 3 a.m. feeds themselves. These newborns are feeding every 2 to 3 hours. No one's getting enough sleep. Everyone is tired. But you start to see other concerning signs like crying frequently with no real explanation. And a lot of times these women know that it's not normal that they're crying as much or as often as they do. And they realize they don't have a specific reason that's really making them sad. And they'll come to me and say, I just feel like I'm going crazy. I'm like, no, you're not crazy. You have an actual medical problem going on, and that it's important to realize that that's not normal for you. And it's a very smart thing to look at this and say, something's not right. I need to
Mhm.
talk to someone. Another thing that we see is moms being less interested in the baby. And that's one of the more disturbing signs for a lot of them is they just don't always feel as connected as they want to their child. I think he kind of hinted at the social involvement angle of all of this. How stressful is it to take care of a baby in a normal situation, let alone knowing that you're the only one and you don't really have that help when you need it? If you just need 5 minutes to get in the shower to feel human again that day. So, finding that support system, making plans, having someone that will come by and let you take that shower, will help you warm up a meal while you're feeding the baby. It makes a huge difference. If you have any kind of pre existing anxiety or depression, making sure that's actually treated appropriately while you're still pregnant. And now treatment looks a lot different to some people. We can run the full gamut of therapy, counseling, medications, even in pregnancy. Those things are possible. We just have to kind of look at the risks with each pregnancy and each individual woman.
Mhm.
But making sure you start taking those steps ahead of time can prevent the depression from getting worse.
Mhm.
Or for women that have a history of depression or have a history of severe postpartum depression, even if they're not getting to that point yet in the last month or so of pregnancy, sometimes we'll look at starting some of those interventions before the baby gets here just to let them start to take effect. Unfortunately, a lot of our medicines do take about a month to reach full effect. I don't have as many women mention that to me, and I definitely don't have the men mention it to me. There is that whole stigma of mental health in general, and especially with men.
Mhm.
Um, to me, I kind of think of it not necessarily as postpartum specific, but it's still that same sort of thing going on with the men that any depression is, even though it's twice as common in women. Men get depression too. The stress of being up, and even if you're not the one getting up feeding the child, if you have a baby in a room in a bassinet, which obviously we want them not in the bed with you, we don't
Mhm.
co-sleep if we can help
Mhm.
it. Um, you may be waking up, you may not be getting the sleep that you need as the father either. And those same stresses that can trigger the mom can trigger the father without the additional hormone complexities of being postpartum. With depression and anxiety, we always kind of think of them as two sides of the same coin. They can flip back and forth. You can have different moms that may have had depressive symptoms before present with more anxiety symptoms in the postpartum period. And a lot of that is really symptoms based. We're looking at a lot of the same causes, a lot of the same risk factors. But with the depression side of things, we think more of being down, being tired, crying, not really having the energy to get up and do the things you want to do or the things sometimes that you need to do. Whereas with the anxiety, it is much more hyperactive. I'm always checking this. I have to check the car seat 5 times before I can buckle the kid in, and then 10 more times after the child is buckled to make sure I've got all 5 points secure. You see a lot of moms with more anxiety type symptoms. They're the ones that really just can't sleep, even if the child is asleep and they know everything is done and the child is fed and warm and bathed and the diaper is clean. There's always something that they're worried that isn't done. And those are the ones that a lot of times are afraid to let the baby out of their sight and just so concerned that something would happen if they weren't right there with the baby awake and alert at all times.
Mm-hmm.
I mean, you take all the stigma that you apply to mental health in the first place, and then you add all of the pressure to be perfect, to be happy. I mean, you just had a child. What a blessing. How can you not be happy? You feel guilty just for not being happy all the time, in addition to whatever else is going on. It's kind of a double standard and double stigma just for the postpartum part of depression. Even though some other things are becoming more normalized, there's still that extra pressure to be perfect, to be happy, to have everything just right. It's important for everyone to kind of keep an eye on their mental health, especially with all the extra stress of the pandemic in the last couple of years. We definitely want to try and screen patients when they do come into postpartum visits. Technically, if you pull up the guidelines and look at them, we do one comprehensive postpartum visit somewhere between 4 and 12 weeks after the baby is born. Every mother should have some sort of depression screening at that visit. I like to do a bit more often. Typically in my office, we'll see all moms 1 to 2 weeks out from their delivery just to see how that initial adjustment to being home is going. Mm-hmm. I'll typically screen both at that visit and the next one at that 4 to 12 week interval. Unfortunately, hair responds to progesterone, being the progestational or pro-pregnancy hormone that's much higher throughout the course of pregnancy. And when those levels drop after pregnancy, well, you have not only your postpartum bleeding, but bleeding, even in a regular menstrual cycle, is triggered by the drop in progesterone that normally happens each month. But that also affects hair growth. It does prolong the amount of time that hair is actively growing. So when that hormone drops off at the end, then yes, hair loss is fairly common. So all the hair you would have lost during pregnancy, a few hairs at a time over that 9 months, may all come out right at the end. Start talking to your friends. Find that support group. Find the other women in your community who have either had issues with depression or who are going to be new moms or around the same time, and really talk to each other. Even if it's, yes, today was a rough day, having just that support of someone to talk to is really, really helpful. Yes, please make sure that, I know the questioner earlier was worried about some thyroid issues as well. Absolutely, that can overlap. It's much less common to have a thyroid issue than depression itself. But one of the first things that all of your guidelines for depression includes, not just outside of pregnancy, but also in, I think it'd be appropriate to screen those ladies for thyroid disorders just to be safe, because a common issue with that is either having too much of your thyroid hormone and getting the anxiety side of symptoms, or too little and getting depression-like symptoms. So yes, there are definitely other medical issues that your doctor can help you tease out if you're open and talk to them when you come in. And don't just do the, oh, how are you feeling today? Oh, I'm okay. And that's definitely a cultural thing that we need to kind of get over, at least in the doctor's office.
If you have depressed mood, I don't mean, clinical depression. I'm talking about just depressed, kind of down in the dumps. That can be from low vitamin D. And if it's low, it needs to be fixed.
Now, I just had a short little tip I wanted to share with you that can help boost your mood and help you cope and manage with any stress and anxiety, and that is getting fresh air and out in the sun. The sun is valuable because it gives us vitamin D, and vitamin D is considered like the happy hormone. And there's definitely a high recommendation, especially for people that are dealing with depression, to get supplemented with vitamin D. And I've made reference in the past about a book from Stephen Alardi called The Depression Cure. And of his 6 recommendations, sunlight was one of them. Sun is a magical quality that can just soothe and bring a uplifting of the spirit. And so if you're in a place like me where we don't typically get a ton of sun, you really want to try and take advantage of it as much as you can, even if it means just opening up your curtains and getting some sunlight through, sitting on a deck, even going outside in front of your place and doing a short little walk. Whatever you can do to try and implement some kind of sunlight into your life is going to be of benefit.